I'm Bunny Ellerin, the president and co-founder of New York City Health Business Leaders, and thanks for joining today's chat. Some of you I know on the Zoom call have been to our live events. Some of you haven't. Obviously, we can't do live events right now, and so we're trying a bunch of different formats, this being one of them. The chat is sort of exactly what it means. It's a chat. We are going to hear from Ron Goldman and Gurnik Singh. They've been members of the organization for a couple of years now, and their company is doing some really, really interesting work vis-a-vis physician and patient communication and engagement. And so I thought that this one would be really interesting to talk about because so many people are interested in this topic, especially now. A couple of housekeeping things. Number one, we're on a meeting, right? So whereas on webinars, it's not, you're muted anyhow. We're gonna mute you while these guys are speaking, but we'll unmute you when you want to speak. So just like if you've got any noise in the background, make sure you're muted. Secondly, Ron and Gurnik are gonna do a presentation for about 10 minutes, and then we'll have some questions. In terms of the questions, one, you can start putting them into chat anytime you want. And then when we open it up, you can use the raise your hand feature. That's always a good one. And I'm gonna moderate, so I will try and get to as many of you as I can. And finally, or two things. One, we have another webinar next week, next Wednesday from 1 to 2 on the coming mental health tsunami, all about, I think it says it all, right? There's gonna be a lot of mental health issues. There already are from COVID and related issues. So we're gonna be talking about that. And also, some of you are members, some of you aren't. We are a membership-based organization. That's how we keep going. And during COVID, it's been a little harder, I think, for all organizations. So if your membership is up for renewal, we would really appreciate if you renewed. If you're a corporate member, we would appreciate if you renewed, because that's how we keep the trains going. So anyhow, with that, I want to turn it over to Ron Goldman to get started.
Great. Thank you, Bonnie, and thank you everyone for joining. As Bonnie mentioned, we want to start with a brief introduction just to tell you a little bit more about the work we're doing. But we want to spend as much time as we can really having a chat with you and getting your insight and thoughts about how this current environment is really going to impact the type of work that we do in healthcare and in health profession schools. So a little bit about us and as we work and the work that we do as a company. So when we started our journey in healthcare about 5 years ago, it really all came from this premise about the power of conversations to change lives, and how if a provider or nurse or a caregiver does a very good job when they talk to a patient or a health consumer, how it can impact their social, emotional, and physical health, and therefore how we have a lot of missed opportunities when they are not well managed. And as a simulation company, the way that we wanted to help that area is by building simulations where we can allow you, whether here on the left as a physician or as a nurse, to actually role play a conversation with a virtual patient that has emotions, can respond to you. So you can really role play and practice a conversation and get feedback about whether you're doing a good job, or if you're not, how you could improve on it, right? So these are online and web-based simulations where we're really harnessing the power of conversation with virtual patients to give you the type of communication skills that can help you manage them well. We've also started to look at the use of virtual humans to do other things, which you can see those are the image in the middle and on the right side. One, in terms of screening and intake, virtual humans tend to be agents that we as real people actually feel very comfortable talking to and sharing information. So they are very powerful in actually doing screening which even though in many cases is a validated measure, people don't always tend to be very honest in them, right? So we are now looking at, can we use this virtual human to actually interact with you, the patient, to do screening for social determinants of health, PHQ-8, depression, alcohol screening. And on the right side, something that we've already done very successfully is doing direct patient education. Instead of just showing you information, to actually engage you in a conversation, to educate you about your condition, about different treatment options that exist, and really help you learn what you need to do and motivate you to do the relevant information. But today, what we want to concentrate on are mainly these role play conversations. Now, I'm not going to play for you a simulation, but try to imagine for a second here that this is full screen, what you're seeing, the image on the right side. You're assuming the role of the provider, and you're having a conversation with this patient who's on the right side. You can make decisions of what to say. As you make a decision, your avatar speaks it. The virtual patient responds. So you started having this back and forth conversation. Obviously, the type of approach that you choose to take completely changes the way that this virtual patient is going to respond to you. So really mimicking a real life role play and a clinical encounter, and giving you a lot of personalized feedback along the way in doing different types and practicing different types of skills, which you can see the main one here on the left, right? These are the core skills that are evidence-based, that are the right type of framework, that if you as a healthcare professional knows how to utilize well, you will get better outcomes, you'll get better relationship with your patients, etc. So these scenarios, and we'll show you a little bit more about the types of areas that we work in, gives you the ability to practice these communication skills, and also get at the end a really in-depth debrief about how well or how bad you have done in each one of the particular goals that we had for you, right? So these about 10-minute or so experiences, which we call role play simulations. You talk with a specific virtual patient with a particular persona, medical condition, and you work through your goals with them, and then you can get feedback at the end, right? So a safe, very practice-based, very personalized experience for you to learn these skills. What we were able to do over the last few years is to also look at a lot of data that we have been collecting from providers. In this case, this is over 225,000 healthcare professionals that have gone through these simulations. And you can see very impressive results, not just from user satisfaction. People really enjoy these type of learning, right? It's engaging, it's hands-on. What you do, you can't just sit back and look at it, right? You have to actually interact, but it also helps build skills. And even obviously, as a company that's in the area of behavior change, to see that we're actually able to change providers' behavior in terms of the number of conversations they have, the outcome of these conversations, all the way to changes in readmission rates, et cetera. So we've been able to do all of that, which has obviously been great. And we have built this portfolio of simulations, which I'll let Gernick talk a little bit more about what we have right now and how and who we sell this to. And then we can get to the questions about how this current environment really must impact this. And this is where we really want to open up the conversation and hear more from you.
Yeah, thanks, Ron. In building our portfolio, we focused on areas where conversations tend to be especially challenging. When you're raising issues like mental health risk and substance use, it requires a lot of skill to elicit honesty from your patient in these conversations, where there may be really significant impacts to future lifestyle, their ability to care for themselves, their ability to care for their loved ones based on what they're telling or confiding in you as a provider. And then we started to expand into other areas where we know conversations are critical for management outcomes. So conversations like chronic disease management, where you really rely heavily on a patient's motivation and willingness to adapt their own behaviors to address their underlying condition. How do you as a clinician successfully partner with those individuals and motivate them to pursue those changes? Well, you got to be able to align yourself with them, right? Not just come in as a guide or instructor. And then we looked at pediatric scenarios where you simply can't get practice talking with parents and their children unless you're in the live clinic scenario. And then dealing with some of the newer issues of the day, social determinants of health, and uncovering what are some of the personal issues people might be battling that are outside of the normal purview of health, but have a direct impact on their ability to follow through on different types of management plans. So, with this in mind, we wanted to think through, how all of these conversations are going to be changing in this current environment, right? And how does removing the direct person-to-person interaction impact those? Couple of areas in which we have excelled is developing research and licensing partnerships with some major institutions that have helped us derive a lot of the efficacy data that you've seen before. So working very closely with the CDC initially on a number of initiatives and getting us connected with other groups, both governmental agencies as well as individual health systems, and now extending more broadly into some payer relationships and other types of professional organizations that can drive communication skills as an important factor in clinical care.
So that was kind of very, very quick overview of everything we're doing. And it really wanted to give you that as context and as background, as these questions, we were talking with Bonnie and trying to think through those. She suggested, maybe we do this as a business chat and kind of pick the brain of all of you to help us think through those. So, as a company that does in this element, right, the professional development of building communication skills for providers, which for us are physicians and nurses, not just the physician itself. There's a few questions, and you can imagine the list is much longer, but these are the 5 that we wanted to prioritize. And maybe if we can try, and Bonnie, if you could kind of help us, and if there are people who want to raise their hand and jump in, we don't have to go in order, but one question is just in this current environment, right? Everything from, as Bonnie mentioned, the influx in mental health, the more of the use of telehealth. How is communication skills, are they actually going to become more important in this new environment or not? That's one question we had in mind.
So let me also jump in. Number one, I've looked at the chats, and actually it helped me talk to my child better. I mean, that was one of the scenarios, like how to manage, like how to get your child to do something. I wish I had it 16 years ago when he was little, but anyhow, so it really worked. I think a bunch of people are on the phone and not on video, so you're not going to be able to chat, but chime in if you'd like to, that's fine. But for those who are on video, can you make sure that you put your video on? And would love to hear from the audience. It's about this. Who wants to start? Okay, we have a very closed audience. Well, all right. So, what are you guys seeing, or what communication skills do you think are going to become more important? You, Ron and Gurnik.
Gurnik, you wanna go first? I know both have strong opinions here.
I do have some strong opinions on this topic. So, one of the key things right now is not just COVID, social distancing, physical distancing, but there are a lot of additional pressures in our day-to-day personal lives that are mounting, and they impact our health in a variety of different ways. For the most part, right, we're limited now in our outlets for communicating these things. I mean, going online is sort of a toxic solution to try and resolve and find community around these things. So, one of the perspectives I've seen is, providers, all providers, primary care providers on up, now having to deal with some more of the psychological challenges that people are facing day to day when they want to get to their chronic care discussions, but not necessarily being prepared or trained in how to handle those types of issues. So, curious to see what perspectives there are, either on the patient side, dealing with those issues, on the provider side, having to manage patients who are coming in with a whole slew of backstory to address, including whatever physical condition might be bothering them.
Yeah, and I can add to that. I think that, you know, as a organization that for, you know, 5, 6, 7 years now, I've been talking within healthcare specifically about communication skills. It's been interesting to see how, you know, initially people were looking at us like, all we care about is the ability to make the right clinical decision. And over the years, more and more people were like, you know, it's not just about the what, it's about the how do I talk about it. And I think that it's been interesting to see the conversation with clients and even just in post about the fact that I think we all just are much more educated consumers of technology. So we know what Zoom is great for and what telehealth is great for, but we're already bringing up the, you know, but, you know, when, and Gernick, you were telling me about some interactions you had in telehealth where you barely see the physician face. You know, they're constantly like just like this, just typing, right? So I think that if I had to answer that question, I would say like yes. And I think that it's also the definition is becoming a little bit bigger, which is part of it has to do with, for example, body language and eye contact are even more important as part of how I communicate on telehealth than I do even in person, right? Because I don't necessarily know that you're typing, I just know you're not looking at me. So I think that organizations, if it's healthcare or even payers and others, even the physicians themselves, they're struggling with this a little bit. And they know therefore that their ability to actually connect with you is more difficult now than it used to be because we're not together in a room. So I think that it will go up, but obviously I'm a little bit biased here. So I don't know if anybody on the audience has an opinion that they want to share on it.
I'm just shocked. Okay, well, yes, okay, Christopher, how do you, can you unmute yourself? And Christopher Cesarini?
Cesarini.
Did I get it right? Cesarini?
You did.
Yeah. Great, thank you for chiming in.
No worries.
Bring it up.
I think Ron's point is very valid. I find it hard to maintain, eye contact when we do these Zoom meetings because I'm looking down at the gallery view and so forth. But specifically as mental health issues arise, and I know more and more people who've been laid off and are really struggling right now and need to see mental health care providers. I would think that would be a very, very personal interaction in which being able to see a provider's, if I were a patient, being able to see a provider looking at me, his body language, sort of empathy required just as, a part of doing that job. How does that, do they know how to make that happen and come across to their patients in a forum like this, in which it's, quite frankly, just less personal? There's, no ways around that. So I think a challenge, and I don't know how that's overcome.
What do you do, Christopher?
I work in marketing.
All right, like, can you?
Well, I worked hospital marketing,
Okay.
so advertising, social, you name it, website development, that kind of thing.
Yeah, well, I mean, mental health seems like the best place. I mean, one of the ideal places to be able to use telehealth, but like the communication skills vary, I think, dramatically by individual.
Yeah. Yeah, I guess my question was, do we think if people are, so if we have to do this remotely, will providers be able to provide the proper amount of empathy and understanding over a device as opposed to, in-person, meetings, in which case these people, require, again, a little bit more hand-holding than maybe patients in other disciplines.
Right. Your question is a good one. Can you train for empathy?
On a computer?
Yeah.
Yeah.
What do you think, guys?
I mean, the short answer is yes. And there's plenty of studies that were done either on our simulations or other training modalities that have shown that you can build empathy or the skill of empathy through a computer so that you can then exhibit it in real life. And real life can be a Zoom call, and real life can be us sitting in the room. So I would say yes, it can be done. I think that the fact that telehealth, I read somewhere that Johns Hopkins is already kind of committing to do at least 30% of their telehealth even post-COVID-19, or 30% of their visit even post-COVID-19 as a telehealth, right? So this is a modality of communication that is not going to go away. And I think that just like we are able to teach people how to show empathy and other communication skills when they meet with people, we can also do this in a telehealth. There are just some elements, including technical elements, that has to be emphasized, including just where is the camera sitting and where are you looking when you're talking to people, but it can definitely be taught.
Can I ask you a question?
Sure, go for it.
Just make a point. We happen to run a national psychiatry and brain imaging clinics. We have 45 doctors that have had to convert in the last 3 months to a lot more Zoom. And the feedback has been very constructive from patients and doctors about they're very comfortable on it. So I would say when we go back to quote, whatever the new norm is, it'll be probably 50 to 60% will be done by Zoom, and the balance will be done in person. And again, this is on a large sample size, so it's been interesting to see the way the world seems to be gravitating towards.
Yeah, and it's interesting to hear that perspective, on the provider side, because, from a patient side, what we've seen are, growing reliances on technology at the expense of person-to-person contact, mostly because it's been restricted. I mean, how many times have you tried to get your provider on the phone only to get an answering service with a promise to get a call back, or just referring you to the patient portal? I think at this stage in the game, patients are now becoming accustomed to the idea that I'm not going to be able to access a provider. So how do I make do and address my needs in that vein? I think that creates an opportunity for technology, obviously, to step in. There's some great data around the efficacy of text-based outreach as a reminder service around whether it's medication adherence, some sort of treatment management plan, and things like that. But, getting buy-in, getting someone to align themselves to that, especially the vast majority of people who are maybe not as, don't have as many resources available to manage some of these things on their own. Like, how do we get them participating in this new form of care, right? The unseen masses who may be getting left behind.
We have, okay, now we're coming in. All right. You're coming out of your shell. I like it. All right. Judith Rubenstein. Hi, Judith. It's nice to, are you,
How are you?
Are you on video?
Can you hear me?
We can hear you.
I'm not on video. Oh, great. So I was saying that there can be a lot of technical difficulties to this part of the training as well, that doctors don't always know how to do this. And so sometimes these calls, which could be a video conference and maybe would be more effective, end up being phone calls. I'm not totally sure how much training is being provided, but also there isn't always incentive for them to get that good at this, because a lot of insurances are paying them less for their services when they're doing telehealth as opposed to in-person visits.
So are they, I'm curious about that. I thought I read that they're being paid like an in-person visit. And if there are any providers or people who know, please chime in. Okay. Well, that's a good point. Actually, Joan Gaffney, you wanted to chime in. Are you? And if you're on video, please turn it on. If you.
I am. I don't know if it's showing. Hopefully you can hear
Yes. Hello.
Hi. Yeah. So I thought that the mental health question was really interesting, and this could to some degree obviously impacts also broader healthcare, but especially I think in terms of mental health, this rise, what we're seeing in the telemedicine and with, working with somebody remotely, it begs the larger question, right, about actually working with providers no longer where you're confined a bit to your local area, but, you could work with somebody, easily remotely is now in another part of the country or even internationally. And what impact does that then have into, the healthcare budgets, both from a local, national, and global level? So just interested to hear any thoughts around those impacts.
I think that we're all reading the news about how the health system budgets or income, right, is going down for multiple reasons, and I think that they're all looking for ways to improve. And it's one of the value propositions of better communication skills, because when we talk to organizations, one of the key value propositions here are really the fact that when you get better at communication with patients, your sessions are shorter, not longer. And they're not just better because you build better relationship, the patient will reveal to you more things, right? You'll get to the point faster. They're not going to mention it as they're out of the door, right? Oh, by the way, I forgot to, right? So that's part of the value proposition. And therefore, again, as they're looking to, can we get more reimbursable activities? Can we see more patients? They're actually looking at communication skills as part of that capability, in addition to things that you mentioned. And so I just wanted to add that as well. I think that there are some legal restrictions about where you can actually practice, depending on where you got your license. But they're looking at both as ways to, recoup some of those lost revenue.
And one other major factor as well, studies are in, physicians who have better communication, not just with their patients, but with their teams, get sued less, right? You see malpractice lawsuits drop precipitously, where you have better patient satisfaction as a result of higher communication. So there's a clear sense of not just capturing more revenue, but also protecting the bottom line from other types of expenditures that they're used to. One institution we talked to, right, spends just one single medical college institution, $40 million annually just on malpractice litigation, right? So it's a major source of challenges, but again, better relationships with patients at the end of the day reduces that, improves outcomes, and delivers on the promise really of what healthcare ultimately can do.
Yeah, and I would even add to that the last question here, right, about provider burnout, which has always been discussed, and I think now more than ever, a recent survey showed that 80% of physicians said that they're at a very high level of stress, just themselves. There are private clinics that are closing, because they didn't have any patients coming in. They used to close because they moved. Now they're closing because of financial issues. And the provider burnout is something that a lot of healthcare systems are really looking at. You don't want that to be at 80%. And again, if part of the burnout or in a way reflects in how they talk to patients, which is not where you want them to show those emotions, or our conversation with patients adding to that burnout, this is another reason for them to, again, make the life of the provider easier by being able to have shorter, more effective conversations with their patients.
So Noah Walski, you had an interesting question. Are you able to turn your video?
My camera's broken, unfortunately.
Okay, we hear you.
I was curious, what the provider response and receptivity has been to kind of additional training. They've already gone through med school, and then here's additional training post med school. I was curious if you guys could speak to that.
And actually, we should ask everyone, Noah, what do you do? What part of the healthcare realm are you from?
Sure. I work in product marketing at Signify Health.
And what does Signify Health do?
Signify Health is a value-based care software delivery platform that also operates in the post-acute and home space.
Okay.
Yeah, so a provider response, I don't know, Ron, if you can click back up to that slide 6. So we measure this particular type of training using Kirkpatrick's methods of evaluation. And the first level is always user satisfaction ratings. And they compare this type of training to the other types of traditional training they get, which is usually intensive in-person sessions that could be 4 hours or more, which isn't really a problem for salaried workers, but for the hourly workers that are many orders of magnitude larger population than the physicians themselves, it becomes a significant issue, budgeting issue as well. But what they find is, because they can use these self-directed online experiences where they can do it at their convenience and at their own time, and they're also honestly a lot shorter, right, than the full 4-hour experience, they're really happy with it. It gives them a sense of control because of the on-demand nature. And it also speaks to something that actually underpins a lot of challenges across healthcare, which is by building better relationships through more efficient communication, you can ultimately be a more effective clinician. The data also shows, right, physicians that have more patient engagement overall report higher job satisfaction. So if they are able to spend more of their time, not necessarily more time individually, but more of their time holistically interacting with patients as opposed to trying to make up for lost time through lack of efficient conversations, they're happier, right? They're happier in their job and they're more effective in their job as well. So we've kind of consistently seen that this sort of modality of training especially is really well received kind of across the board. Now, it doesn't happen on its own. Demands on physician time are excessive, and that applies to all other roles. So it really takes administrative level interest in reaching those demands. Now, there are all sorts of measures and metrics now for these types of things. Everybody's familiar with the HCAHPS, patient satisfaction scores, CMS star ratings. So, because it's now become something that these institutions are measured on and also can impact reimbursement rates, there's a much larger emphasis on these types of skills overall.
Thank you.
Yeah, thanks, Gernick. Ivor, Juster,
Hi.
you had a bunch of comments along the way about.
I was
Yeah,
trying to
so
sneak
go
them
for
in
it.
edgewise here.
What?
I was just trying to sneak them in edgewise
Good.
without actually being called on. But anyway, hello everybody. Ivor Juster.
Ivor, what do you tell us what you do?
I'm trained in family medicine and emergency medicine. Right now, I'm doing medical informatics. This is just a simple question because physicians have to have, depending on the state, 25 to 50 continuing education credits a year. Probably the same for other clinicians. So, are you providing, or could you provide continuing education credits for this training?
Yeah. Yes. All of our simulations are accredited if it's for CME or CNE for nurses or even for social workers. So that is part of kind of again, it's not the key reason, but it does help to make sure that the learner gets even more out of this besides the skill and the behavior change, also the continuing education credit. And I think just to kind of maybe lead to one of our questions, when we work with these organizations, and you can look at the top part in terms of actual, and this is a partial list of clients who are health organizations or state or federal agencies that have licensed our professional development simulations to train physician, nurses, etc. In most cases, it is the QI, quality improvement group, right, that have identified a particular area where physicians or nurses struggle and wants to address it. Or it is the patient experience, patient engagement individuals that obviously understand that relationship or relationship-centered communication is something that they have to do as an organization. So the question that we have, and kind of slash a hope, is who else within the health system or other type of organizations like payers may see the current environment and decide that their communication skills is something that they need to get involved in? Or will communication skills development stay confined within the QI people and the patient experience. So it's really a buyer persona question. I'm curious if anybody has an opinion on who else might get involved in recognizing this need.
How about caregivers? So caregivers, especially now, because there's something like 16, 17, 18% of employees are also informal unpaid caregivers. Now that many of them are home, they're probably actually being called on to either caregive more, but that communication and understanding and empathy would be an important, that's an important skill for them, because one of the big losses to employers for caregiving is productivity, absenteeism, and presenteeism.
So do you think that employers would then be interested in something like this?
Well, if they have, through their benefits program, if they have an EAP, I guess they all do,
Yeah.
or they have, then there's family medical leave, and some of them have special programs for caregivers of the employees that are caregivers, that is, and so on. So again, I'm thinking of the medical and clinical side of this, not so much like the generalized need that everybody really has. We could all really communicate a lot better.
Yeah, that's a great point, Ivor, because I know certain states, especially California, people who stay home to take care of family members are actually paid by the state
Right.
as federal care workers. I don't believe there's actually any training or support for people in those roles outside of the monetary remuneration from the states, but I think that's actually something that does need to be addressed, because there are a lot of challenges that are being foisted on these individuals as primary caregivers without any training necessarily.
Yeah. Thanks, Ivor. Next up is Beth Payne.
Hi there, can you hear me?
We can, Beth. Nice to meet you. And tell us a little bit about yourself. What do you do? What part of healthcare are you in? Now we lost you.
Can you hear me now?
Yeah, now we can hear you.
Okay. Great, yeah, so I also work in marketing. So we focus on marketing mostly to HCPs. So this conversation is interesting to hear about the training. And my question is for anybody who has thoughts on this, and it's kind of two-part, but my original question was kind of about a good short-term solution as we are moving through navigating this pandemic time, but it seems that telehealth is kind of being implemented as a short-term and then potentially a long-term solution. So the first part of my question would be, are there any best practices that are really, fairly simple that anybody has seen? The example that you all had given is that the healthcare worker is typing and looking down and not engaging with their patients, but are there any other, quick best practices without going into deep dive and training, or in the meantime of that as a short-term solution to provide HCPs with some skills that they can, be more effective in telehealth until it becomes, better training and, whatever they, especially if this continues after post-COVID. And I guess the other part of my question would also be, does anybody have any thoughts on what a transition back into in-office clinical visits would look like? Has anybody experienced any combination approach between in-office as well as telehealth?
So I cannot help you with the second one. But with the first one, what I would recommend, there's a great organization we work with. It's called the Academy of Communication in Healthcare. They've actually posted kind of a list of best practices for telehealth in terms of communication that you could check out. It's on their website, Academy of Communication in Healthcare.
Wonderful. Thanks.
Anybody else want to, did I miss anybody? I don't think so.
I think something that I've gathered from this call is that, and we already had conversation about it internally and starting to do the planning, is that our scenarios right now gives you the ability to practice a conversation that occurs in person, right? Just like you're seeing right now. And what we are doing, and it sounds like we should do faster and even more of it, is to give you the ability to practice a conversation that doesn't happen in that setting like you're looking at right now, but instead in a telehealth, right? A little bit of what we're doing right now. And to add on that, the ability to, in a way, really teach you and give you practice in doing some of those elements like eye contact and what is even the frame, right, of should you see the hands or not the hands, etc. in it. So that's one thing that we took that we already started to put into our roadmap, so that organization that by our training programs will be able to gain practice in both in-person and a telehealth setting in terms of the communication skills that they practice and build. So that was very helpful.
Okay, Victoria, yes. You know, I've never learned how to say her last name. Is it Tiasi?
Exactly, Tiasi, thank you.
All right, do I win a prize?
You do, well done.
I took Italian in college. Right.
And Vicki is fine. Hi, all. I am at New York Presbyterian Hospital, and I am a nurse informatics researcher. And first of all, this is fantastic. Thank you for this presentation. From a nursing perspective, I feel like this is very needed. So, and you probably know some of this, but in nursing school, we get multiple courses on how to communicate with patients. And I think the interesting piece with the telehealth visit is that in the office setting, in the live office setting, a lot of times you're interacting with a nurse or a nurse's assistant before you see the provider. So that's now missing. So there's an important component of the visit that we might not be capturing when it's just the provider. So I really like this idea of thinking through how do you work on the empathy and really elicit that information from the patient that the physician might not always be the one doing that in the office visit. And in terms of the emphasis from our health system on communication, I think we, you know, at NYP moved things so fast that we really didn't have the opportunity to think through some of these pieces. So we are certainly going back now to take a look at that. We are now getting our patient satisfaction scores. We just started that on June 1st. So I think it's too soon to tell now, but I think that'll be really helpful for us to understand once we start to see those responses, what are the types of things that we might need to work on that are missing. And most specifically, I'm looking at the interpreter side to telehealth. And I think that's a real interesting component, especially for our diverse, underserved patient populations that maybe we were not reaching initially. And now with COVID, we realize that we need to figure out how to connect with them. And it is actually super complex to figure out how to pull the interpreter services into the telehealth visit. Do you do it by audio? Do you do it by video? And how, as a provider, do you manage that interaction with the patient and the interpreter? So I think those are some interesting dynamics that would be worthwhile to explore as well.
Thank you.
Thanks, Victoria. Actually, I had a question about that. So, you know, the nurse's involvement or absence of involvement in telehealth is definitely noticeable. I've had a telehealth visit or two, no nurse interaction whatsoever. And I know a number of nurses, you know, who've been furloughed or hours cut back as a result of, you know, lack of inpatient services. I'm curious how that's been addressed at your institution. Are the nurses just being asked not to work, or are they being inserted in different functions to support kind of this now distance care approach?
So I think it's varied. Obviously, it's a Unfortunately, it's a state by state, problem to tackle right now. So there are certain states where NPs are permitted to perform telehealth visits and other states where they are not. So it certainly depends on where you are in the tri-state area. Second, there are some organizations where very quickly the providers had the ability to see patients from their homes, but the NPs could not, given reporting structures and essentially who covered or who gave them their paychecks essentially. So I think there's some interesting issues to tackle there, and I think now we are going back to really figure out what are all of those pieces that we're missing and how do we pull that together. And I think there's a lot more that we can do with nursing and telehealth. We've got some national initiatives going right now. There's a new Future of Nursing report that's in the process of being put together. And this is going to be a big piece to that, because can we have more patient interactions, patient teaching, for instance, done by nurses through telehealth? And how do we get that paid for?
Thank you. Thanks a lot, Vicki. We had one more question or comment from Elizabeth Bailey, who is the author of the patient's checklist, which I think you gave me a while ago, so thank you. Are you there, Elizabeth?
Yes. I don't know if you can hear me. Can you hear me?
We can.
Can you hear me? Okay, sorry, my audio is on the fritz. I in a way was coming at it from the same angle as in many ways as Victoria, but from the advocacy side, and having worked as a patient advocate in a hospital setting and then in other hospice settings and just the private setting. I think one of the things that I think is actually could be very promising about telemedicine is that it does present an opportunity for
Now we're losing you.
Oh, can you hear me now?
Yeah.
Can you hear me? Having worked in a hospital outpatient clinic as an advocate, those patients had to travel long distances on public transportation, for a clinic visit. They always had to take a day off work. They often had to wait 4 hours in the clinic to see a physician for 10 minutes. I mean, the whole system did not work for them. And I think there's a whole aspect of having a patient be in a home setting where they're comfortable and having, if they give permission, family members to be with them could potentially really impact how they engage in their care. I also agree with Victoria. I think that the whole idea of needing interpreters is huge. And that was always, I did a lot of that work in the hospital, working with interpreters and families, but it was always, it was almost like you were always on a lag in terms of the conversation. And I think if there was a way that could be incorporated in telemedicine, that would also have a profound impact. And finally, I think it's an interesting aspect of now particularly when families cannot be in the hospital with any patient. It's not just COVID patients. It's no matter, for whatever reason that you're in the hospital, you're dealing remotely with care and care management. And we all know that families play a huge role in caregiving, the comfort care and I hate the word compliance, but, just taking care of the day-to-day care burdens for patients. And I think that the the moment of being able to actually see, to look at a physician or to look at a nurse, to see a face, to see expression, that doesn't exist in a hospital setting at the moment, or even in clinic settings. Everyone is, masked and gowned and gloved. And I think if there's some way that working on what you're talking about, like working on the human component of how do we deal with strengthening that within a digital setting. It could be an important
Thanks. Thank you. Yeah, that's great. I don't see any more comments or questions. So unless anybody wants to chime in, I want to thank Ron Gurnick and everyone who was on the Zoom for your input and comments. I think if it's okay, Ron, we will share the slide afterwards. Is that okay? Okay, great. Any thoughts?
No, this was really interesting. I think that what we heard confirmed some of the thoughts, Gurnick, that we had in internal discussions with the team, that communication skills was always important. And now that we added even more barriers between us and the patients, if it's a telehealth or a mask, they will rise to a level of importance that we've never seen before. And I think the recognition of that is very high, which is great for us. But I think that the challenge for the providers and the nurses and other health professionals in terms of their own burnout, in terms of the mental health and social health challenges that will increase, will make these communications more difficult. But at the same time, it's a great challenge for us as a company that's what we do, help people build these skills to create and continue to create communication skill building experiences where people can learn how to do that well. So this is an exciting time for us to really rise to the challenge. So thank you.
Thanks. And if folks have ideas for additional conversations, make sure to email us. We'll send out a survey and you can add it there. But for now, thanks for joining, and I'll hopefully see some of you on our webinar next week on mental health.